Good morning. I am so happy to have you here. Today we are going to continue our discussion on type 2 diabetes. And specifically, we're going to talk about the medications that we use to help manage and treat type 2 diabetes. Now, who am I? I am Dr. Lindsay Ogle. I am a board certified family medicine and obesity medicine physician, and I specialize in treating and preventing metabolic disease through evidence-based medicine, weight management, and lifestyle optimization. So I am so excited to share this knowledge here. And if you'd like to follow and get to know me more, I have an Instagram and a Facebook at Dr. Lindsay Ogle, and you can find the links below. I also have opened up a metabolic telehealth clinic called Missouri Metabolic Health. And this is a telehealth clinic for patients all throughout the state of Missouri. And this is what I do all day, every day. I help treat and prevent metabolic diseases such as diabetes through lifestyle optimization and weight management. And I utilize medications when necessary and appropriate. And so today we're going to talk about what some of those medications that I use are. So as a recap, insulin resistance, prediabetes, and type 2 diabetes is really one disease that is a spectrum of insulin resistance. So it starts when the blood sugar is in a normal range, and then it progresses to elevated blood sugar that can be in a prediabetes range. And then once it gets to a certain level, then we diagnose someone as having type 2 diabetes. And the most common ways that we diagnose that is either with a fasting blood sugar or a A1C. The fasting blood sugar means that you have not ate or drank anything that has calories in it for 8 hours or longer. And if your blood sugar is 126 or higher, you are in the diabetes range. And if your A1C, which is a way that we can estimate what your blood sugar is over the past 3 months, if your A1C is 6.5 or higher, then that is in the diabetes range. So those are the cutoffs for the diagnosis of diabetes, and that is what we are talking about today. So the very first recommendation, first line treatment for diabetes is actually lifestyle changes. And the last video that I posted last week talks about lifestyle optimization in the setting of insulin resistance, prediabetes, and diabetes. And briefly in that video, we talked about cutting back on added sugars. We talked about increasing protein and fiber. We talked about reducing stress. We talked about increasing physical activity and movement. And so with lifestyle utilization, the effectiveness of that really depends on what a person is doing before. So if before someone has not been utilizing any of those lifestyle tricks, then if they start doing that, they're really going to see a huge improvement in their blood sugar levels, and they may not need a medication whatsoever. And that's wonderful and that's great. And if they keep that up, then they're going to continue to control their diabetes without the need of a medication. But that's not the case for everybody. A lot of people are already utilizing these lifestyle recommendations, and because of genetics or other factors that we may not be aware of right now, they are still in the diabetes classification. And these people really benefit from medications. And the first line diabetes medication is something that has been around for a long time. It was first FDA approved in 1994, so it's been around for 30 years now. This medication is called metformin. As I said, metformin has been prescribed for 30 years, and we as a medical community would not keep a medication on the market that long if it was not safe. So metformin is a very safe medication when used appropriately. So one of the biggest reasons that someone should not be taking metformin is if they have significant kidney disease. So chronic kidney disease that is very, very advanced stage, stage 4 or greater, then really that person should not be on metformin. But if you have early kidney disease, then metformin is safe to take. The kidney function should just be monitored, which we do for everyone who has diabetes. We're watching their kidney function regularly. So again, only for advanced kidney disease is why we would not start metformin. The early kidney disease is okay, and actually taking metformin to help lower your blood sugar and improve your diabetes is long-term going to be much better for your kidneys than if we did not treat your diabetes. The most common side effect by far for metformin is stomach upset or GI upset. And this is very common, usually with starting the medication. It often gets better with time as your body gets used to it. So the way that we limit this side effect is by starting at a low dose and then slowly working our way up to higher doses as needed and as tolerated. And if you're having an issue, you just slow it down. You don't have to push to get the highest dose within the first week. It's okay to take your time. Diabetes is a chronic medical condition. It is not urgent to get your blood sugar in a normal range right away. It didn't go high overnight, and so it's okay if we don't fix it right away. We can take our time, and again, we're thinking big picture, preventing complications of diabetes long term. It's also recommended to take it with food. So take metformin with breakfast and or with dinner, depending on if you're doing the once daily or twice daily dosing. Taking it with food can help with that stomach upset. Another common side effect is actually over years of use of metformin, it can lower your levels of B12. So you have a couple of options. You can go ahead and start a B12 supplement along with your metformin, or periodically you can have your B12 levels checked with your doctor with your routine blood work. And if you find that it's low, then you can start the supplement at that time, but something that you definitely want to be aware of. Metformin is a very inexpensive medication. It usually costs $20 or less, oftentimes less than $5 for a prescription of metformin. So very affordable. It is a pill. There's a twice daily dosing, which is usually the less expensive option and is a smaller pill. The once a day extended release version is usually better tolerated on the stomach, but is quite a big pill. So some people are not able to swallow that, and it's often a little bit more expensive, but again, usually $20 or less. So very, very affordable for most people. Metformin has been associated with longer lifespan. So it has been studied for uses outside of diabetes, and people who take metformin on average live longer, have less incidences of certain cancers and heart disease. So there may be other benefits associated with metformin. It's often also used in patients who have prediabetes to prevent the progression to diabetes, and it's sometimes used in patients with PCOS or polycystic ovarian syndrome to help manage the symptoms associated with that. In the future, I will definitely have a video specifically about PCOS, so stay tuned to learn more about that condition that is pretty common in our female population. Second line diabetes medications are GLP-1 agonists or SGLT2 inhibitors. So it's really two classes of medications, and depending on the patient in front of me is really how I make that decision which one to choose after metformin. So let's start with the GLP-1s. So this term may be familiar to you because these medications are Ozempic and Mounjaro, which are super popular right now because they are also used in the weight management and obesity medicine space. There's actually different brands that are FDA approved for weight management, and that is Wegovy and Zepbound. There are other brands that have been around for many years that are in this category, the GLP-1 agonists. Some of them include Trulicity, Byetta, Rybelsus, Victoza. There are a few other ones as well, and these are still around and can be prescribed. They're just not as popular as Ozempic and Mounjaro. But these are really powerful medications. All of the medications in this class, other than Rybelsus, are injectable medications, and most of them are weekly injections. The injections are actually very, very easy to give yourself. It's a very small needle that just goes right under the skin. Painless injection that you give yourself in your thigh or your abdomen, or you can do it in the arm. And most of them are once a week. Victoza is daily. And again, Rybelsus is the oral version, and that is also a daily pill that you would take. Like we said earlier, these medications are also associated with weight loss. And so that can be a huge benefit to patients who have diabetes and are also looking to lose weight and maintain that weight loss over time. Another great benefit that we have had studies that have proven now is a cardiovascular benefit. So these medications have been proven to be helpful with preventing heart disease, especially in patients who do have diabetes, but also in patients who don't. So very, very exciting information that we have for these medications. The biggest drawback really is how expensive they are. So if insurance does not cover these medications, they are $1,000 on average per month. Now there are coupons available that can cut the cost down somewhat, but usually they're still several $100s a month. So this is really important for you to make sure that your insurance would cover these medications. And often the best way to find out is either call your insurance directly or talk to your doctor and have them prescribe the medication if it's appropriate for you, and then you'll find out at the pharmacy if it's covered. The most common side effects are stomach upset, nausea, constipation, or diarrhea. And ways to really limit these are by making sure that you're eating healthy foods, avoiding a lot of added sugars in your diet, making sure you're getting enough protein and fiber, eating small meals consistently throughout the day, and avoiding an empty stomach are really important. Making sure that you're well hydrated, so drinking lots of water and sometimes including electrolyte drinks into your routine can really help offset some of these side effects. And if needed, we may use medication to help with symptoms such as nausea, or add a fiber supplement or a stool softener for some of these side effects, again, if needed. Oftentimes they're fairly mild and get better with time, and we always start at the lowest dose and then slowly increase our way up. At the fastest, we increase once a month. So we really give your body time to get used to the medication before we increase the dose. And this has been very effective for the majority of my patients, and most people are able to tolerate it with minimal or zero side effects. I've only had a few patients who really have found the side effects intolerable and needed to stop the medication because of them. Most people do really well on these medications. In parallel to that is the SGLT2 inhibitors. So these are not as popular in the general population, but they're extremely popular in the medical community because they have so many associated benefits with them. Not only are they powerful diabetes medications, but they're also powerful at helping with conditions such as heart failure and chronic kidney disease. And it seems that we're finding more and more additional benefits with these medications all the time. So the most common brand names of these are Jardiance or Farxiga. And these are pill medications. And so you take them once a day, usually in the morning. The way that they work for diabetes is that